Turning to some health news now, if you have experienced back pain, you are not alone. In fact, 80% of people will experience it at some point in our lives. The good news is that you don't have to live with it. The experts at the UC Health Hospital are back and neck and spine center personalize an approach that gets you the right treatment at the right time.
80% of folks are going to have an episode of back pain in their life. In general, the vast majority of that pain resolves on its own.
The human body has an incredible ability to heal itself, and it's our job as doctors to help nudge that process along. And that involves things like physical therapy, medications, injections.
Here at the Gardner Neuroscience Institute, we don't jump right into surgery. We start with a comprehensive evaluation and assessment and work through a battery of non-operative tools and innovative technologies we have to return you to the level of functionality you had before you experienced pain. Spine care in the academic system is different. We're constantly pushing the boundaries of what's possible.
We're able to collaborate and figure out what approach is best for that patient. For instance, a patient might come in with a condition that can be easily treated with physical therapy, medications, and injections. Then care is escalated to the treatment by a surgeon.
Our clinicians are not just providers, they're surgeons, educators, and scientists. You're getting access to tomorrow's discoveries today.
We have orthopedic surgeons, neurosurgeons, physical medicine, rehabilitation specialists, and pain management specialists who all work together to make sure that we can offer patients a variety of non-surgical and surgical options. When patients have a pinched nerve that causes pain, either radiating down their arm or their leg, that can potentially cause weakness and dysfunction, we have to go in surgically and release that nerve and take the pressure off of it. That can be done through traditional open, larger incisions, or we can do smaller incisions.
Minimally invasive surgical procedures that we offer patients don't cut any muscle, very limited incision, very low blood loss, and the patients tend to return home and to work almost the same day. We are pushing innovation, our use of innovative technologies such as robotics, assisted surgery, and endoscopic technologies that aren't available anywhere in the community. When you think about surgery, most people think about general anesthetics. You're put to sleep when you have surgery, but there is a different type of anesthetic that you might imagine. We could do these same procedures now where you're fully awake and comfortable using a spinal anesthetic. You go home the same day, you have no fogginess, and more importantly, none of the side effects that you see with general anesthetics.
We have a large team. We're very proud of the fact that we question things. We aren't simply just doing things according to routine.
It's personalized care of tomorrow that you're getting in Cincinnati today.